State. Well, joining us via Zoom is public health physician and health promotion specialist, Dr. Obinna Ebirim. Good morning and happy holidays. Thank you for joining us.
Good morning and happy holidays too.
All right, now quickly speak to us about the recent rise in the cases of cholera. What is at the heart of it?
So I will start by saying that thank you for this opportunity to enlighten the public. Cholera is, I am not surprised that there's a cholera outbreak. And why I say that is because cholera is nicknamed the disease of poverty and inequality. So, and that speaks to the point you made about UNICEF calling for increased access to clean water, sanitation. What are those risk factors associated with cholera? Cholera is more when you have people in a case or communities where people have limited access to clean water, to good sanitation, where there's increased malnutrition, where the hygiene level is very poor. So you all know what is happening today. Simple, what we call pure water, although some people query how pure is pure water. The cost is high, so people do not have, the access has reduced. Some people have, but more people are increasingly lacking access to even pure water. That's the would say the easier access, more accessible, purest form of water that most Nigerians have. So when you have that situation, there is an increased likelihood of diseases like cholera breaking out. As you know, it's a disease caused by a bacteria that gets in through our mouth, either through unclean water or food that has been contaminated by feces carrying the bacteria that causes cholera. So that's the situation we find ourselves in. But the good news is that it's preventable and it's treatable. And that's what we are here this morning to enlighten the public on some of the things they need to do to prevent.
Absolutely. And if I get you correctly, it's in the process of people perhaps finding a cheaper alternative to what what was initially accessible. That is why we're seeing what we're seeing as it is now with regards to the outbreak.
Yes, very, very correct. Yes, it's that, because obviously, how can people get cholera? You get cholera when you have when you're taking water that has been contaminated, right? So if someone before could afford maybe any of those bottled water or sachet water that at least to a certain extent is pure, but right now because of the rising cost, he can't afford it, and he decides to then take water off maybe a pool of water or water that it's not, you can't query its source, and maybe that water has been contaminated, maybe because of its handling, people did not wash their hands, someone who's maybe the hand got contaminated with the feces containing the bacteria, and then the person ingests that water, and then that's the spread of cholera. Or people are now eating, maybe before you're used to eating in a place that is a bit hygienic, right, where they wash their hands properly before they cook, and maybe because of the rising cost of, you know what it costs now to get food in some of the basic restaurants, right? I then decide to go to a lower place where they don't wash their hand properly. Maybe the environment around there is a bit very dirty, and maybe dirty water spills into the pot and it's not well cooked and all that. And those the water they use is contaminated, right? Then that's why you're having this spread. So it's not really. That's why for some of us, the public health especially, it's not surprising that we're having that outbreak. I think it's the reaction, the population's reaction to the increasing level of limited access to basic water and sanitation.
And reactions following this incident have been speaking to the fact that we've not really been able to move from the preventive measure to the curative measure. A few years back, we had environment officers who moved from local government to ensure that everyone is maintaining and having good hygiene. Do we have to introduce that for this to work again?
Yes, why that is one of the ways to prevent, but I think we can start with basic things, right? So if everybody watching this show today commits to washing their hands when they get out of the toilet, before they handle food or handle water, right? Especially, and not just at home, for those who work in the food and beverage industry, those who run restaurants, hotels. If you commit to hand washing by yourself and all your staff, and then at home we commit to also washing our hands, I think that is a good start. It's cheap and it's something that is easy for everyone to adopt. Secondly, if we all agree today that we are not going to eat half-cooked food, our food are going to be properly cooked, and we're going to use clean water. If we agree that in our own immediate environment, right, we will keep our environment clean, right, I think that those are the ways we can minimize the spread of cholera in an outbreak like this. But however, as you rightly said, there are some people who would not do the right thing unless they are compelled to do. So that's where policies and laws come in. And that's why there's also a need for us to go back to those days where we have sanitation officers who ensure that people are keeping their environment clean, and maybe there are sanctions or consequences where people litter the environment or maybe are not even preparing food. So we had also officers who go to restaurants, who go to food chains, who go around, and if the way you prepare your meal or your food, it's not in the best practice, you're not adopting the best practice in terms of sanitation and hygiene, those food chains and industries are also sanctioned. So I think there is need to introduce all that, but then let's start with the basic ones: hand washing and good hygiene at home.
And like you mentioned that cholera is a sickness of poverty. What do you make of food vendors who use raw materials, who use materials that are not up to quality just to, get as much profit as they can? If I decide to wash my hand before leaving the house and I decide to patronize them while being outside, at the end of the day, it's really not as effective.
Yes, I think that I need to say this clearly today, and this is something that we all need to change as Nigerians, our culture, our way of doing things, right? There is no right reason for doing a wrong action. I know some people who are watching who are into business will say, hey, how do you expect me to make profit when to get water is not very expensive, to do this is expensive, maybe fuel or gas, kerosene or gas to cook is expensive. How do you want me to cook the food properly, right? But that is not an excuse to do the wrong thing, because you think about it, we talk about, I would say, what do you call it, in quotes, ritual money, bad money. If you do something intentional, right, to hurt a group, right, that can also be seen as an evil money, because you're trying to make profit and then in the process getting people ill, killing people, because cholera is a very, very dangerous disease. It's a disease that if you get infected, you would have frequent acute diarrhea, that is stooling, frequent stooling, and if nothing is done, if you can't prepare a quick ORS to give to that person and then rush the person to the hospital to get rehydrated and treated with the right antibiotics, that person might get into severe dehydration, heart failure, renal failure, and death, right? So this is a call to people, especially food vendors, those who prepare our food, the public eat. Please, there is no right reason to do the wrong thing. Make sure you prepare your food in a hygienic way, use good food. It's better to even add a little cost to your meal and prepare in the right way than trying to cut costs and make that large savings and at the detriment of people's health. Because cholera is real, it's killing people. As you mentioned earlier on, there's over 140 cases and 30 deaths. And even in a country where there is also a gap in our surveillance, it might even be much more in local communities that are not reporting such deaths.
Right. In fact, we had reports recently of persons adding dye into palm oil as it is. And now those are reports, really sad reports as it is. And we hope that we can quickly tackle these issues. But then let's talk about cholera itself and the points where it gets really fatal. How people can identify that this is what is actually going on with them and should perhaps quickly get to the hospital, and what steps they can take immediately to address it before it gets fatal at the end of the day.
So once at this point, especially with an outbreak, and also even when there's no outbreak, if you're stooling and you have passed at least 2 loose stools, right, within a short period, right, you need to seek care. And then you just pass one stool and it's rice water is like watery whitish, and you see it's like the tap has been opened and then everything is just gushing out liquid form. You need to seek help, right? And some of the quick things you can do, especially in a country where sometimes the health facility is far from us, there's also some factors or access issues, right? There are quick things you can do. You can prepare ORS in the house. It's not difficult to prepare. Once you have your salt, you have your sugar, you have a teaspoon, you have 1 liter of water, you can mix it up and then prepare an ORS you can have. Or you quickly rush to a nearby pharmacy and get it and mix it with water. There are a lot of there. And this might be something you might even have in your home. As you have paracetamol, you might have an ORS handy so that if peradventure you get into any diarrhea disease, this is the first quick home remedy you can quickly do. And then the next thing is to rush the person to the hospital. It's not something I can manage in at home. It's not something you can say, okay, let you go to the chemist, in quotes, as Nigerians do, to say, okay, manage. A chemist might not be able to set up a line, because in diarrhea, in cholera, you must rehydrate that patient, because what really kills people with who have a cholera is not really the disease right itself, it's just the symptoms. So when you keep passing those stools frequently, you get dehydrated. That's, you lose water, a lot of water, and with that your organs begin to shut down, and then death is imminent. So my advice to everyone watching me today is, first of all, you've done things to prevent yourself from getting cholera, as we mentioned earlier on. Maybe if peradventure it happens, please quickly give that person an oral rehydration solution. It's out there. Something you can purchase off the counter, and then rush that person to the nearest health facility. It is not something you can treat at home. That was my advice to people watching us today.
All right, let me just quickly follow up with this question now. The Lagos State government has come up with a center where persons with this, whoever has perhaps contracted cholera, can quickly be brought in to administer treatment and all of it. But talk to us about access to treatment as it is. There are reports saying perhaps there are vaccines, there are ways to quickly address this, but what's the level of accessibility to treatment as it is, and what state governments can do to quickly curb the rising spread? We know that in some states, like in the north, we're already seeing some states, Zamfara, Nasarawa, Katsina, Bauchi, and we also have in Delta, Rivers State, and all of that, and Lagos as inclusive. So what can we be doing now quickly to addressing these matters?
Yes, I'm happy you mentioned there's a vaccine, and it's one of the very cost-effective and potent way to prevent cholera. We have an oral cholera vaccine that is being approved by the World Health Organization, approved by our NAFDAC to use in Nigeria. So our advice, that mass vaccination, that's one of the response whenever you have an outbreak of this nature. But then also, it's also increased surveillance, because as I mentioned, there are a lot of people at the moment who are dying in communities because of cholera, and it's not reported because there is no strong surveillance system to pick it up. Some of the surveillance officers are in the health facilities, they are not in the community. I mean, people are not dying, and people are falling ill, they're not seeking care, right? They're not picking them. So we need to increase our surveillance system. As I mentioned, also mass vaccination. Good enough, we have the oral cholera vaccine. Also, you talked about access. It's a key problem, and it even goes beyond an outbreak. In this country right now, I don't think there is over 10,000 functional PHCs in Nigeria, serving over 250 million or WhatsApp population as of today, right? Now, PHCs, primary healthcare centers, are the ones that should provide 60%, take care of 60% of the population and their health needs, right? But where you have just a little number that are functional, then it limits the access. And that's why you see people begin to patronize chemists, pharmacy, our tertiary system, the teaching hospitals that should be research centers, right, are now being overburdened, right? So I think that government needs to do more to improve access. And one of the ways you do that is ensure that you have functional, not just infrastructure. There are a lot of PHCs scattered else in this country that are being locked up with equipment inside. They are not functional, right? You need to have functional PHCs, right? There should not be a ward in this country that shouldn't have at least 1 or 2 or 3, and for the big wards, even up to 5, because at least 10 kilometers from where you live, you should have a PHC you should go to, right? And then also there should be improved health education, because the health seeking behavior of people, especially some Nigerians, are very poor. You're ill, you want to wait until it gets bad. Some people are hearing me at the moment, and tomorrow they'll see someone with diarrhea, and they'll wait until and say, oh, we'll try something, they'll try this leaf, they'll try this drink, they'll try, oh, let me take, what's it called, raw diarrhea, and all that, it will stop. And you see the person stooling, passing stool for 5 times, watering, and you've heard that there is a cholera outbreak. You will not rush that person to the hospital or support that person to go to the hospital. So sometimes our health-seeking behavior is poor, and that's where health education comes in. And this health education, we should realize that it's not just on social media, it's not just on TV, right? Our people in our local communities do not have access to something, so we have to use traditional means, town criers, and whatever means that resonates with them, and people who they listen to, the religious leaders, the traditional leaders, to pass this information to them and say, there is an outbreak of cholera. If you see anyone stooling, take that person to the health facility. And if the health facility is far, at least you can start oral dehydration therapy before you take that person to the nearest health facility.
And I agree with you on the fact that awareness needs to be done, a lot of awareness. Anyways, let's talk about post-recovery complications. It's interesting that many persons have set aside their hand sanitizers since the COVID-19 season. Talk to us about the post-recovery complications.
Yeah, so when people recover, some people can recover without any, especially if it's addressed quickly. But then some people recover with some renal issues and other related health challenges, right? I think that because of the nature of this interview, let's not bore people with some of those medical issues. But then what I want to emphasize is that treating a disease, it's better you do it very fast, because then remember your organs, right? They require water, they require a fluid environment to remain active and functional. If you deny that for a long time, it will lead to complications such as renal failure.
We'll have to leave the conversation here now. I believe the message has been passed to every viewer listening. Dr. Obi Naibirim, Public Health Physician and Health Promotion Specialist, thank you for your time.
You're welcome.
Right. And finally on the show today,